Thank you for taking the time today to attend our presentation, See GE Vital Signs in Your EHR. Our speaker today is Laurie Blunt. Laurie is the Director of Medical Device Integration at Iatrix Systems. She has more than a decade of healthcare experience, half of which has been dedicated to connecting medical devices to hospitals' EHR systems. Laurie has managed successful medical device integration implementations at numerous hospitals and healthcare systems across the nation. She has received her Bachelor of Arts in Business Administration from Southwestern University in Georgetown, Texas, and came to Iatrix Systems in May of 2013 with accent on integration. Now I will turn it over to Laurie to get us started.
Thank you, Carrie. Hi, everyone. Thank you so much for joining our webinar today. I know it's December and everybody's busy, so I hope to cover some good territory. We've got a lot to cover, so I'm just going to dive right in. First, we're going to talk about our experience integrating GE Vital Signs monitors at Hanover Hospital. They were a customer site that recently went live with our Accelero Connect solution. And then we're going to talk about all of the different types of medical devices that you can integrate with your EHR. We're then going to give some special attention to smart pumps, since they seem to be a topic that everybody wants to learn about these days. Then, of course, I'll demonstrate Accelero Connect application and the solution, and we'll break for questions. After the demonstration, I'll then touch on the importance of IHE standards, I'll give you a link to our GE connectivity brochure that we collaborated with them on. I'll also give you some recommendations for project approach for device connectivity and a high-level roadmap, really. And we'll finish up by talking about what the future holds for medical device integration in general. We'll leave you a little more time at the end for Q&A, which actually reminds me, as we go through the slides, if you think of a question, go ahead and type it into the questions pane of your GoToWebinar control panel. We'll gather up all of those questions, and when we break for Q&A, we'll answer them at that time. I'm going to talk a little bit more about the detail around that implementation at Hanover. They use GE Vital Signs monitors throughout the facility. So in their critical care unit, they already had a solution there. They had GE equipment. It was already interfacing with the hospital's EHR they were using GE B650s in the CCU. The CCU was looking to possibly replace that legacy integration solution because it wasn't scalable. The legacy solution apparently didn't filter patients well, and without a bunch of customization, the staff was unable to, they were actually seeing all of the patients at the hospital, and they didn't want to do that. So they just wanted to see what was in their unit, and when they tried to customize that legacy integration solution for CCU, they found that they couldn't expand it hospital-wide. And the Accelero Connect team, when we started working with them, we worked with GE to implement a more flexible filtering for patient admit data. So it suited the needs for every one of their departments that were part of that solution, and now they're able to use Accelero Connect throughout the entire organization, which is great. Their heart and vascular outpatient unit, that was a brand new unit. They just opened it, and they were using GE B450s there, B450 monitors. And the nurses that they hired to work in that unit, they were coming in from other hospitals where they were already accustomed to integrating vital signs and doing vital signs documentation through an integration solution, through an automated solution. So the nurses were expecting an integration solution to be in place for this new unit. They were not about to, in other words, they were not about to go backwards in time and start manually implementing a workflow to get vitals into the computer. Obviously, Accelero Connect was able to help give those new nurses exactly what they wanted. And the biggest transformation was actually in their ED, in the emergency department. The clinicians in the ER were manually keying in vitals from their Dash 4000 and Solar 8000 monitors. And last winter, when their, I don't know if any of you recall, their patient population in that part of the country was hit really hard by the flu. They were in Pennsylvania. And vital signs were not getting keyed into the computer right away because they were so swamped. In fact, they told us that their ED was so busy that their VP of nursing was putting on scrubs and helping out. And I'm sure you know there's two big problems with having to do a manual process for those vital signs, especially in the ED. One is that either somebody is going to key them in right away, but during the chaos, you're going to see typos, and the information could potentially be incorrectly entered in, by virtue of haste. Or two, the data doesn't get into the computer until there's a break, which could be, at the end of someone's shift. And now, with Accelero Connect going live for that unit as well, the nurses in the ED are ecstatic because they don't have to manually key in those vitals anymore. And so that's great. It's exactly what we wanted to see. So we're going to show you in a little bit kind of what that looks like on the Accelero Connect side. I mentioned in the agenda that vital signs monitors aren't the only medical devices that we could integrate with Accelero Connect and that we're going to talk about. On this slide, you see kind of a generic diagram that displays a bunch of different device types that Accelero Connect could integrate with EHR. On the left, there are what we call networked monitors. So in the case of Hanover, all of their monitors were networked through their GE CareScape gateway. But those could be any vendor's networked monitors. So Nihon Kohden has a gateway, Philips, Mindray, they all have gateways, and that kind of connectivity is pretty common for us. We call those gateways that sit on the biomed network. But outside of that, on the hospital network, you might actually have standalone devices like the low acuity monitors at the bottom part of your diagram. The ones that are listed here are Welch Allyn, but there's also the Philips VS3s, for example, VS4s. There's also ventilators and smart beds and smart pumps. All of these devices' results have data that Accelero Connect could consume, which could then be fed into your EHR for documentation purposes. Hospitals, Hanover Hospital just happened to have also PCS and EDM modules, so Accelero Connect in that particular implementation was able to get those results from GE over into those interventions in Meditech for both of the modules. So let's switch gears and talk about smart pumps, since there are quite a few folks in the audience that are interested in that topic. Typically when we talk about smart pumps, people do say they want to connect their smart pumps with the EHR. No wonder, that seems to be the topic of the year. I think part of it is just there are so many adverse events associated with mistakes that are made during the manual process of programming a pump. There's a lot of buttons to press. But the broad scope of smart pump programming is actually a bidirectional interface with the EHR. So let's level set for a second and go through some definition around these concepts first. On the front end, you got your smart pump programming. That means you're sending medication orders from the EHR to the smart pump via an electronic interface. So for that workflow, a nurse will scan the patient, they'll scan the bag, the drug, then the medication order information would be sent from the EHR to the pump or the pump gateway behind the scenes electronically. And with this kind of solution, the nurse wouldn't accidentally program or have to key in manually the wrong dose because that order information would be auto-populated from the actual pharmacy order in the system. That's the real beauty of smart pump programming. It would prevent those kinds of errors and adverse events. But the nurse still has the responsibility of verifying that the data is correct before they start the infusion. So they still have to perform the 5 rites before pushing start on the machine, but obviously all of that is on the display ready for them to verify before the infusion starts, decreasing the risk dramatically for error. The other big time savings is on the documentation side. So that's the other, when I said bidirectional, that's the other direction of the interface. In the HL7 world, what this means is getting ORU results messages off the pump device to the EHR for patient documentation. These results messages occur every time there's a pump event, so start times, stop times, just like vital signs results really. So Accelero Connect can receive those pump messages, which also contains things like volume administered, volume remaining, of course the drug name. All of those pieces of information would go right into the fields in your EHR's nursing documentation system via the integration solution. So, excuse me, if your reimbursements department, for example, also wants to see this information, they've kind of gotten on you about documenting start and stop times or getting better about that to improve revenue fulfillment, then automating this documentation would be of interest to you. Here's a catch, though. A bidirectional smart pump EHR project is not easy. There's been a lot of testing and things that have to happen to ensure that it's done right. We're talking at a minimum a 6 to 9 month implementation timeline. And there's going to be quite a few staff hours, probably hundreds, and heavy involvement from nursing, pharmacy, IT, biomed, to make sure that everything's working as expected. That's probably the biggest reason why so few hospitals have done it. You can see 2 pie charts on this slide. As of 2013, only 9 hospitals had done smart PIP integration, and none of them were Meditech sites. This data came from CLAS, and I know CLAS has done an update on this report this year, but we don't have the new pie charts yet. But I can tell you the new numbers that we've taken a peek at, and the numbers are only up to 38 hospitals, which is still a fairly low number, in my opinion. So still, there are none that have integrated their smart pumps with the Meditech side of the EHR world. We know that these are Cerner and Epic hospitals. So Cerner and Epic are in the lead as far as in terms of the number of live smart pump EHR implementations. Let's switch gears now and talk some more about interoperability concepts. If you aren't already familiar with IHE or integrating the healthcare enterprise, here are some buzzword concepts for you. When a device vendor or integration solution vendor says something like they adhere to IHE standards or they support a certain IHE domain like PCD, which is that stands for patient care device, they are talking about the fact that the HL7 messages that are being sent by either the gateway or the individual device, those are adhering to the message standards maintained by this organization. In other words, by establishing and maintaining a standard for data produced by and consumed by medical device systems, IHE helps these systems become interoperable. In other words, we're all speaking the same language. All vendors participate in IHE voluntarily, and interoperability is accomplished through extensive testing, particularly at their annual IHE Connect-a-thon event. The IHE testing is overseen by National Institute of Standards and Technology, also known as NIST. Last month, actually, NIST co-presented with IATRIC Systems. I don't know if any of you were on there. I didn't cross-reference the list. But we co-presented with NIST an educational session on how IHE is advancing medical device connectivity. So that recorded webcast is available if you haven't seen it. It is on our website also for free. And by the way, I'll just pause and mention here, you will actually get today's PowerPoint after the presentation is adjourned, and that will include a link. And just a heads up, that recorded webcast is probably best suited for technical folks, the IHE webcast. But for clinical folks, what you want to take away from this particular slide is that when you purchase new medical devices, whether it be smart pumps or low acuity devices or really anything that you want to integrate with your EHR, you want to make sure you be sure to ask the question of your vendor if they've accomplished IHE testing with those particular devices as well. Because sometimes a vendor will say, we've done this IHE testing and this is the profile that we're in, but they won't list out which devices actually fall in that sort of testing assumption. You want to be sure you ask that question. And you also want to ask them for proof of the testing, which is what we call an IHE integration statement. We've actually got one on our website, and we'll provide a link for that in this PowerPoint as well. So if you have any questions about how to interpret the IHE integration statements or really what the domains, what that means, what the profiles, assumptions are. We're happy to walk you through it. We've got my senior VP actually sits on the IHE board, and so we've got quite a few folks here who know the IHE world. GE, of course, is one of the vendors that has participated in IHE testing. In fact, that's really where our relationship with GE began several years ago. Recently, we published a connectivity brochure with GE, and you see the examples on this slide here of what that brochure looks like. It is also available on our website, and it's got a link in this PowerPoint, and it's also available on their website. That brochure talks about all of the different devices that can be integrated with an EHR conceptually, and different methods for integrating those devices. What does it mean to be networked versus not networked? These are some of the GE devices that can't be. Well, here's an example of a GE device that cannot be integrated with your EHR: Dynamaps. We just got word from our GE contact that it's not possible to do this because Dynamaps, or even their V100 replacements, those historically required a special cable, and that cable is no longer available. But this brochure talks about the fact that your dashes, your solars, your B450s, there's a pretty large list on this brochure, and even the new B40s. Many others can be integrated with your EHR, and they're adhering to the IHE standards, and you just really need to ask the question, what is networked, what is not networked, what are their connectivity methods, and what do their messages look like? Are they adhering to IHE standards? Those are all very good questions to ask your vendor as you're purchasing new equipment. I'm going to switch gears now and talk about project concepts. Hospitals often ask me, either during the sales opportunity process or even at the beginning of an implementation phase in a project timeline, what devices should they integrate first? Sometimes our contracts with our hospitals have multiple devices on the contracts, and generally speaking, we recommend integrating continuous monitors first, then take a look at low acuity devices, mainly because continuous monitors produce a lot of data, and we know that data needs to be documented regularly. The low acuity devices, they roll around cards, you don't have as much data coming from those. And so vital signs, especially in critical care areas, is highly sought after data. These devices are typically the easiest to integrate because they're either already on a networked so they're already on a gateway, and or they have communication capabilities maybe through their central station. The IHE compliance is probably already directly built into their firmware. So that's the reason why we believe that vital signs monitors are the first devices that you should look at integrating to your EHR as far as documentation purposes. After that, the priority really depends on your hospital's initiatives. For example, if reducing ventilator-acquired pneumonia is a big push at your organization, then you may want to take a look at integrating your ventilators next. If there's a lot of pressure to reduce medication errors at your hospital, or maybe you want to consider smart pump programming as your next device type to integrate. Some hospitals want to take a look at their OB systems because they want to get maternal and fetal monitor data documented to their EHR, and they don't have that right now. So whatever you do, we do recommend taking it step by step. Either break it down at the project level by device type, and then at a unit level, ideally. A smart pump integration EHR project has its own set of challenges versus an OB integration project versus a vital signs integration project. So, not doing a big bang implementation is going to increase your ability to have some good wins when it comes to medical device integration. Also, we find that hospitals have issues funding medical device integration because it typically competes with other initiatives, other pressing issues. So we did put together an ebook, and it's on our website. It addresses some of these cost justify concepts and what to take a look at when you're trying to get funding for a medical device integration project. It's also on our website, and there is a link on this PowerPoint as well. So if you have any questions about that, the brochure, and any other integration hurdles that you might think you're going to come across with Accelero Connect, or just integration solution in general, please contact us. We're happy to help. So hopefully by now you're envisioning a future where nurses can spend more time with their patients, and all of the medical devices integrating with EHR. With the next generation of medical device integration, you're probably going to see smart pumps responding to monitors and vents and vice versa. And things like ventilator-acquired pneumonia could be a thing of the past just by virtue of the integration solution. But something else that's very possible in your immediate future is the fact that having vital signs results available immediately in your EHR allows you to automate other downstream systems like early warning scoring systems. So here's another story. I'll give you another anecdote about one of our customers who's doing that. They're Hamilton Health Sciences in Canada. They just had 2 major healthcare magazine articles published about how they're preventing code blues and other emergencies using their vital signs to automate their early warning scoring system. We'll send you this PowerPoint later today, so you'll have a link to that as well, the article. But in a nutshell, here's the story. The hospital, it's a 7-hospital health system in Canada. They have over 1,000 beds and 400 vital signs monitors. And those monitors are integrated to their EHR via Accelero Connect. So now they have their patient vital signs in their EHR. Then they built an early warning scoring system, real-time, behind the scenes. They've got this, their rapid response teams are no longer responding to adverse events. With this new system, they're actually preventing them. And it's a very exciting story to tell. The article it's fun to read. And that's the real beauty of having medical device results immediately available in your EHR, is you can improve patient outcomes with that data. And there's been a lot of talk about big data and analytics and how the two worlds can blend and make everyone's lives better, including the patients. Hamilton Health Sciences is a perfect example of that, of how predictive analytics can help improve patient care. They couldn't have done that without medical device integration. So it's a good story.
If you would like more information, please contact your iAtric Systems account executive or send an email to info@iatric.com. I'd like to thank Laurie, and also like to thank everyone once again for joining us. I hope you have a great day. This concludes our webinar.